Good morning, everyone. My name's Lorraine Simpson. I'm the Managing Director at The Lines Between. We're a social research agency based in Edinburgh. We were commissioned by the Life Changes Trust to carry out this evaluation on the basis of our experience of working sensitively with families and a history of inclusive research with seldom heard groups. I'll be talking for 15 minutes. Essentially, I'm summarising our 50-page report, which I think you've already received a link to, where we describe the individual award scheme and the impact on those involved. Over 18 months, our team collected and analysed lots of information to inform the evaluation. We had conversations with people who received the awards, 47 carers and 28 people with dementia. We spoke to 18 staff across the organisations involved in delivering the awards. We ran workshops and we looked at information gathered by the Life Changes Trust and delivery partners, application forms, monitoring forms and feedback. Our report includes lots of examples from unpaid carers and people living with dementia in their own words. I'd encourage you to read it if you have time. We've had good feedback about its value in explaining why and how the individual awards made a difference and the policy implications of this work. We wrote the report in clear language with many different readers in mind. So I'm going to cover the key themes in my 15 minutes here, but if you can read the report, please do. First of all, I'm going to talk to you through today's presentation with a quick outline of what I'm going to cover. So I'm going to describe the awards to you, the purpose of the scheme, where it took place and which partners were involved. I'll tell you who received the awards and how they used the money. I'll describe the difference that the awards made to people's lives and wider benefits that perhaps were not anticipated when people applied for the awards, what we learned about why this programme was successful. And finally, I'll share a short case study so you can see the real life impact of an award. It links with the title on my first slide, Small Award, Big Impact, Long-Lasting Difference. That's a brief summary of what I'm going to talk about today. And I'm going to start with a short recap of what the individual awards are. So the Life Changes Trust ran a small, successful pilot of an individual award scheme in Argyll and Bute in Edinburgh in 2014. They knew they had something that worked and wanted to learn more and recognise the growing interest among policymakers in effective ways to address loneliness, improve physical and mental well-being, and put people in control of support that makes a difference to them. So building on this success, they established a larger scheme across 3 areas in 2018. And that's the scheme that I'm describing today. The individual award scheme provided up to £500 for someone with dementia or someone caring for a person with dementia in an unpaid caring role. Those who received an award could spend the money on anything that they believed would make a difference to them, and they had up to a year to do it. The Trust funded care and repair organisations and local partners in Aberdeen, Lochaber and Angus to administer the individual awards to people affected by dementia in their area. So that's a little bit about the awards themselves. We also looked at the demographic profile of those who received an award. 602 people received awards. A third of these were between the ages of 75 and 85, a quarter 65 to 74, around 10% were under 54, 59% were female, and 64% had a long-term health condition. That's a highlight of some of the features on that slide. We've got lots of stats in the report for you to look at. We also looked at where the recipients of the award were from and how many award recipients were people living with dementia or unpaid carers. Roughly speaking, the awards were split half and half between unpaid carers and people with dementia. And nearly a third of the awards were linked, which means that 2 awards were granted, one for the unpaid carer and the other for the person with dementia that they supported. In terms of geography, half of all the awards were made in Aberdeen, a third in Angus and a sixth in Lochaber. And the vast majority of people applied for awards between £300 and £500. Half put the award towards something that they themselves also made a contribution to. So that's an overview of the award recipients. I'm now going to talk a bit about what they actually spent the awards on. We can see that the average spend amount was £467, and people could spend the award on whatever they liked. When we looked across the spend, we saw that this typically fell into one of 4 groups. I'm going to go through those categories, what people had spent their award on, starting with home renovations and gardening. A third spent the award on their home or garden. This made sense in terms of where people spend most of their time. They wanted to make the best of the environments that they lived in. But also, when we spoke with families about their situation, we heard about the amount of skill, time, energy, and effort that can go into maintaining a home. And people simply didn't have the capacity to do this in the way that they used to before the onset of dementia or before caring responsibilities came to the fore. Their time was absorbed. 12% spent the award on their garden and 8% on home repairs. So that was one big area of spend. Another common theme was trips, breaks, and experiences. Just over a quarter spent their award on a break or experience. And these stories were spoken of in joyful and moving terms. The anticipation of the experience and the memory of the trips were highly valued. The short breaks typically fell into one of two types. So unpaid carers using the award for some respite, to recharge and have a short period of time for some self-care, or to spend time with their other family members in a non-caring environment, or to share a break with a person living with dementia, reconnecting with an element of their past, or to visit someone special to them, in some cases for the last time, or to make new memories together. We also found when doing our research that new furniture and appliances were very popular to support people living with dementia and unpaid carers in the home. Often this was linked to the amount of time that people spend in their home and the importance of having reliable, comfortable equipment. Some used it for IT to help them stay connected with their family and social networks. So that's a little bit about how people with dementia and unpaid carers chose to spend their awards to support their own well-being and day-to-day living. But what about the impact of these awards? All of the awards were valued by recipients, as evidenced through the feedback that the Life Changes Trust received and the details that people shared with us in the interviews. We identified 8 main types of impact. The main finding across all of the awards was the contribution to emotional well-being. 3 out of 5 said that the award helped in some way with emotional well-being. It took many forms. For example, people explained that their stress level had reduced from having something practical, like a new boiler, or something rejuvenating, such as respite care. They described things that gave them ongoing pleasure, a new DVD player or piano lessons. One woman said that she was no longer embarrassed to have visitors after spending her award on redecorating her living room. Another important impact that emerged in the analysis was improvements in physical well-being. Chairs, beds, carpets, improvements to flooring so that people didn't fall over, having a smoother path to their garden so they could go out and use that space. And these often had a knock-on effect to the emotional well-being of people as they felt better or were more able to do the things that they enjoyed. Another finding was the greater sense of feeling connected and more interaction with others. This was highlighted by some unpaid carers and people with dementia. For example, one woman living with early onset dementia put the award towards buying an iPad and used it to FaceTime her sisters who lived abroad. Her partner was at work during the daytime and she valued the company. Another unpaid carer described his mother's deterioration in mood over a period of time. He applied for an award for a new TV, and when she received that, she started to have lively discussions with him and with her paid carers about programs that she'd enjoyed watching, or things that she had plans to watch, or things that they might recommend for her to look at. Memories revived, or new memories with trips of significance, were also a feature in the discussions about the breaks away. One woman used the award to pay for a hotel so she could take her mother to Dundee, which she'd been asking to do for a while. Dundee held fond memories for her mother from her childhood. And recipients' comments also suggested that for some, the award contributed to a sense of financial empowerment. They bought things they might have not done, or bought something of a better quality than their budget would have allowed them to do. Others felt able to buy a treat, and there was a very real sense of treats being out of reach for some of the unpaid carers we spoke to. Things like travel, hobbies, family events, all of these things became more possible because of the small budget that was available. Prevention was another theme in terms of impact. Some of the practical projects or practical help that people received reduced hazards and saved people from struggling to fit in activities that were threatening to overwhelm them. In turn, this reduced stress and worry. Combined, these small but important changes promoted independence and supported people to be able to continue living independently in improved environments at home. Long lasting. Some of what's already been described will clearly have long-term impacts. The new equipment that will last for years, and the new memories made that can be meaningful for years to come. One practical example, one woman in Angus dealing with the early stages of incontinence said a downstairs toilet had improved her daily independence, emotional well-being, and made her daughter and other carers' lives easier. And connections to support. Some said that as a result of getting involved in the awards, they knew more about what their local care and repair team or dementia enablement service was able to offer them, and they had received help with other things, such as equipment that was useful, or even accessing benefits that they didn't know that they were entitled to. Far-reaching, finally. Beyond the award recipients, there were knock-on effect for others. The circle of family, unpaid and professional carers and wider family relationships as some stresses were removed and aspects of emotional well-being improved. For example, adult children described their relief at seeing less stress in their parents' home while one parent was caring for another. And de-escalating some of the stresses at home helped people cope with their caring role, and in some cases resulted in new forms of unpaid support coming forward. For example, an unpaid carer used the award to go on a break and arranged for her sister to come and care for their mum for the first time while she was away. She said that as a result, her sister's understanding of what was involved in her daily unpaid caring role had increased. She started to absorb what it meant to be helping her mum with the toilet, with changing seats, and of keeping her company and not being able to go out herself. And she said that that kind of new understanding of what she had been doing had really improved the relationship between the two sisters, and her sister had got more involved. So clearly there are some very tangible impacts, but what we also found was that there were some knock-on effects which led to secondary impacts. Through one example of practical spend, I hope to demonstrate the many changes brought about by a smaller world that might not have been envisaged on paper. So you can see here the cleaning and gardening services that one couple used the award for. They told us that this made them able to enjoy their home and garden, which had been a really important part of their lives together. And spending time in an enjoyable way at home gave them more energy. The husband, who was a carer for his wife, talked about his kind of stress around wanting to keep up that environment and being conscious that he needed to spend time with his wife, and that was kind of draining the energy that he had. So he felt more energetic because he didn't have to worry about those things. And then because he was spending less time on those activities, he was able to do more activities with his wife outside the home. They would go to the golf club, or they would go out for a cup of tea or a cup of coffee, and they were spending times with other people outside their home more than they'd done before. They had better quality time with friends and family, and both of them felt more socially included. So that was the feature of them being able to enjoy the home and garden, but all of that added to more time for them together, a reduction in the levels of stress that both of them were feeling. His wife said that she felt less lonely because her husband wasn't often about spending time trying to fix the garden, and both of them said that they felt happier as a result. So we've heard about the positive effects that these awards have had on families and individuals, but what's the wider learning from the programme? Here I want to summarise features of the award scheme that we identified as critical to its success. Firstly, simplicity. There was a very simple application process, and this was crucial for engagement. It was very clear that complicated applications were off-putting for households for many reasons. For example, people having to get their heads around complicated changing situations at home, engaging with different services, already having high levels of stress, putting them off getting involved in something new, or having a to-do list that was also very long. So having a simple process was important to them. Flexibility was another important feature, and the inherent flexibility in how the awards could be used made applicants feel trusted and able to take control. They were able to use the award for best effect on something that reflected their specific needs and circumstances. And although we'd identified the 4 key types of spend, within that, people use things in very different ways depending on the specific needs of their family or their home. Trust, support, reassurance, face-to-face contact from someone that they already knew and who knew their situation from the local care and repair team and partner organisations was a really important element. People are unlikely to access the award without this route in. And when we had conversations with unpaid carers and people with dementia, they said that those first conversations when the award was introduced to them, it was really important that that came from someone that they knew and trusted. The personal approach was also important. So using the local delivery partners meant that people had support from someone who was friendly, knowledgeable. They helped them understand how the awards could be used and why the opportunity was there. And again, that helped people to feel in control and reassured them about the application. And the non-prescriptive nature of the scheme provided freedom, dignity, and choice. And we found these key to unlocking the potential of people directing their own support. Before I go, I just want to introduce you to Betty. Betty used her award for a new walking fame. Before applying for an award, trips in her life had kind of been reduced to the essential. So typically to the doctors or maybe the supermarket. And whenever she went out, she needed her family with her to drive her there. She wasn't walking about. She now has her own wheels. That's what she called the walking frame that she got through the award scheme. And she enjoys walks with her family members and getting fresh air and exercise regularly. I'll give you a moment to read the comments from her family. So that's really a general whistle-stop tour of our evaluation. I hope you found this presentation useful, and I'll look forward to answering your questions in the panel discussion later.